Hello everyone, I'm Dr. RMD and you know me because I'm your NEETPG mentor and your NEETPG counseling guide. So the reason for this part 3 is because of the counseling delay. Obviously counseling had already been in discussion since August 15th, where I had released 2 videos, and this is the part 3rd of the video because now I've got several queries from students and their parents telling how to fill choices. Okay, that was the reason for today's video. Okay, so what I felt was there is a need for in-depth discussion because I also started receiving many queries over my social media regarding how exactly to fill choices. So we'll be covering following points today. That is, one is what are the smart rules of choice filling which you should never miss. Second is what is the thought process that you should be involved when you are filling your choices. Third is we'll discuss few case scenarios with few ranks. What are the case scenarios different and what choice filling order should you use? Okay. Fourth is what are the warning and precaution. This is most necessary. If you don't watch anything else, kindly watch this because you'll lose your valuable seat if you don't go through these points. And last is additional information regarding further rounds. I'll be covering in brief. Okay, so this will be a short video, very crisp, no bullshit. Okay, first, general rules. Remember, these things are frequently overlooked. Okay, like for example, reviewing your eligibility. I don't know, there is a frequent discussion in the Telegram groups and even on many platforms telling that this year domicile is not in effect, which is completely wrong. This decision was given in January 2025 regarding a case between Union Territory of Chandigarh and a candidate. Okay, so in the Union Territory of Chandigarh, now there is 50% reserved for institutional and 50% is for all India quota. There is no something called as direct state quota in Chandigarh, but this currently is only for Chandigarh and maybe 1 or 2 states might apply. That doesn't hold true for everyone else. That is because people started asking me, like for example in Rajasthan, they're already a domicile of Rajasthan and they started asking me, sir, I'm a resident of Rajasthan, but I want all India quota somewhere else. I will get seat somewhere else. I asked, why won't you get in Rajasthan itself? Because you're already eligible for that. They said this domicile quota is not there. Then I went back and I showed them the document that it is only true for Union Territory of Chandigarh and some states which might open up in this year. Okay, so that's why you should review your eligibility in each state counseling. Remember that this year not all states have come up with the brochure. Like All India MCC has come up with the brochure which it mentions the eligibility criteria, but few states have not yet released. Like Maharashtra has not yet released its eligibility criteria. So there are many states which haven't released. So you should be updated with brochure of each state and your eligibility criteria, because if you don't know this thing, you might not even participate in the counseling, thinking that you are not going to get any seat there. Okay, so this is the first point. Second is ignore last year choice list. This is the most frequent question which I'm getting. Like, what candidate has chosen last year, you are going to choose the same thing. Like what you guys do, I know that you use Zynerd because I know Zynerd is the best platform. So what you do, you go through all last year's choices. Like you put in MD medicine for a rank of 1000, I need all these colleges. And what you do, the biggest mistake is you fill the choices exactly according to that list. But let me tell you, last year's choice list is not equal to best colleges choice list. Okay, I'll tell you with example later on, like how last year whatever toppers had chosen is not what is best according to you. It depends on case to case basis. So you need to make your own choice list. If I tell you that last year someone had chosen MAMC pediatrics as first choice, he may be mistaken because as far as I know, as I have asked, as I have interacted with other PGs and all, what I realize is among Delhi colleges, RML pediatrics is the best. This is not just my opinion, it is a collective opinion which I have gathered from everyone. Okay, so you will miss this these subtle points if you go through last year's choice list. Third is always prefer branch more than college. This everyone tells. Okay, this because branch stays with you for lifetime. It's not like you're getting some very good college in a branch which you don't like. I'll let you know that most of the students in this case regret choosing that branch after 3 years. Okay, or maybe during the course of residency itself. So branch comes always before college. Fourth is MD is always preferred more than DNB except in metropolitan cities. For example, if you're getting a peripheral state college or peripheral top college versus a DNB college in Delhi, like for example, Gangaram Hospital is a very good center for like medicine and pediatrics. So if you choose other colleges, less like state peripheral colleges over Gangaram DNB, then I think you are going to do a big mistake. So that is why I say metropolitan DNB, they have very good exposure, they have very good patient load, they have very good infrastructure. That makes it the one of the best choice compared to state peripheries where you don't have any infrastructure, because nowadays everything is evidence-based medicine. Next, what is the general order that you have to follow? This is the general order, but there are exceptions to this. So first is always central hospitals MD degree, followed by state top hospital. There will be state 1 or 2 top hospitals. Like for example, in Kerala it is Calicut and Trivandrum. In Karnataka it is Bangalore Medical College and Mysore Medical College. Same in Tamil Nadu it is Madras and Stanley. So each state will have 2 top medical colleges. So that will be your second priority, because these are the best colleges after central MD colleges. Okay, and third will be DNB metropolitan colleges, because in metropolitan cities DNB has much better exposure, much better variety of cases, and much better training compared to peripheral state MD colleges. Then comes private metropolitan colleges, like for example MS Ramaya in Bangalore. It has actually very good infrastructure, it has very good exposure compared to state like MD degrees in some periphery. Okay, so if you are affordable, then this option is a good one. Then comes state MD periphery, and last comes peripheral DNB. Okay, so this is the general order that you need to follow. Exception to this is one surgical, because in surgical what happens is in central hospitals, especially Delhi hospitals and all, your cutting chances is less, because in Delhi and in some especially in Delhi, what happens is there is SR based culture, that is senior resident based culture. So you will be getting less chances, and also in places where there are DM candidates for surgery, like MCH candidates are there also your chances of getting the surgical cutting chances is less. So that's why state colleges are usually preferred in surgical branches. It is not only limited to general surgery, it's also equally applicable to surgery, ortho, and even OBG. Okay, so this is important one. Best college is not equal to good PG residency. Good PG residency is determined by a variety of factors, which I'll be discussing you in the later part of the video. And last is, if suppose you are not getting a good MD seat, let's say MD medicine you are not going to get in a good college, but it's in your state or near to your home, choose that seat, because if you are going to do SS, then wherever you do DM from, that matters, because when you do SS, MD is more like a survival kit, again just like your MBBS. So MD matters, it's not like it doesn't matter, it matters. But if you're comfortable choosing a less college, if it is near to your home or something, you want to prefer that, it is good ahead to go ahead with it. Okay, so these are keeping these general rules in picture. Let's see how the thought process for counseling should go ahead. You already know most of you are using Zynerd. If you have not used, I strongly recommend at this point you start using Zynerd, because your choice filling process will be very simple. So in Zynerd you will be using this option called as allotments. Okay, and allotments will have closing rank, 2 options. Okay, one is closing rank and another one is allotment results of last year. So in this you should use closing rank, because closing rank will give you exact idea regarding what rank that particular institute has closed. Now what you will do in Zynerd is you will enter all your ranks. Like for example, let's say my rank is 10,000. Okay, and I want a pediatric seat. I want to know where I want to get pediatric seat. Okay, so you will be entering a range of 4,000 rank. That is because if your rank is like less than 1,000, you will be entering a range of 500. But if it is like more than 5,000, then you will be entering a broad range. That is because you don't know which seats will be added. Like let's say you have EWS criteria, and last year for pediatrics in MD, let's say your rank is some 10,000, and there were like no seats in Karnataka Medical College. Let's say in Mysore Medical College there was no seat in pediatrics. Okay, but this year the EWS seat has come. So when you search for last year, you won't get MMC as option when you search for EWS. Okay, so that's why I say keep wide priorities open, and everything should be there in your priority list. It is not just the colleges that you would get, it also includes the colleges that you might get also. Okay, so that should be in your mind. Second is choose all the rounds of counseling, and third is whatever quota. One important thing, DNB quota you'll only get when you click on this particular option under Zynerd. So be very careful. If you are choosing for DNB, then you should click on this choice, that is DNB post MBBS, or else you will miss DNB colleges. Next is general category. Okay, whatever is there your category, and then coming to the branch. So I was surprised that for a rank of 8,000 MD pediatrics all India quota, I was able to get all these options. Okay, so through Zynerd it was very easy. So there were total 17 possibilities that were there, and these included hospitals in Silchar, that is Assam, then Ajmer, Surat. So these are like good colleges, but most of these colleges went in 3rd or 4th round. Okay, that is stray vacancy or 3rd round. So that is one more lesson from this NEETPG counseling, that is if you wait longer you will get better seat, but the risk is also higher. So who can take this risk? Those who are confident that you'll get a decent amount of seat, you should go with by second or third round. You shouldn't wait more than that. Go ahead with the first round, do your admission, then keep on upgrading. Okay. But those people who are at border range rank, like example 10,000 rank, and you want a clinical seat in either pediatrics, or maybe you want an OBG or something, or ortho. So these people can wait up to third round or even fourth round. The problem with stray vacancy is, if you like choose a stray vacancy round seat, then you'll have to take it at any cost. Okay, either you get a seat or you don't get a seat, and if you get a seat, you have to take that seat, or else you will be barred from counseling. Okay, so these are certain risks you need to take if you want to get a good seat. So last year you see that after 8,000 rank, these 17 people got pediatrics in government institutes only. Okay? These are all government institutes. Okay, so now what everyone does is they'll go to zynerd. Okay, they will get the list of colleges. They'll start filling this college list as such. Okay, so this is one place where you make a big mistake, because you think whatever last year toppers had chosen, whatever last year's choice listing was, that same will continue this year. No, never. Because here starts rule number 2. What was rule number 2? Rule number 2 was ignore last year's choice list. Your choice list is just to get a vague idea, like what you can what are the main colleges, what are the main branches you might get. But what happens really is you should go ahead with this 8-point objective system which I have devised. Okay, these are the 8 points that determine whether your MD residency in an institute will be going to be good or not. Like, one is academics, especially true for like medical side of branches and pre and paraclinicals. Second is how much is the work-life balance, so very important. Third is what is the infrastructure and investigation, equally important nowadays because of evidence-based medicine. Next is bond. Actually, many people say bond doesn't matter because anyways you have to do 1 year SHA. I'll tell you, you don't know what will happen in your life. There might be a point in time where you will be thinking of so many things, and suddenly something comes up and you'll have to you can't go ahead with your degree, you just want to get out of it. But bond makes that slavery kind of thing into effect, so you won't be free on your own. Okay, but the problem is this year many Delhi colleges are going to introduce bond. So far MAMC has introduced bond, but most of the colleges like RML and VMMC have not yet released bond. Okay, there is no official notification yet. So still in RML, that I can assure you, bond has not yet come into effect. Okay, so if you're going to choose, you can choose hospitals other than MAMC which have not initiated bond yet, but I think we'll get to know in the future days. So MAMC has definitely has the official circular is released regarding 1 year bond. Okay, so next, stipend also matters because you're going to dedicate your 3 years, your youth, and after that you have so many things coming up ahead of you. Like immediately after PG or before PG, during PG or after PG, you're going to get married also, and then you will have to roam the world also. You will have adventurous mind also. Okay, then once I hate to say this, but once you have kids, then all your peace of mind is gone. Okay, you have so much budget. Actually, you need income. You need a regular constant source of income, and if your stipend is good enough, you can save some things, and that actually forms a base to continue your life ahead. New opportunities get opened up. You can invest it somewhere. I've seen many people especially central institutes like AIIMS and even like Delhi colleges who get good stipend. They invest it wisely, and then they, after 3 years, they come up with good returns actually. Okay, so this is a totally different financial aspect which I'll discuss someday else. So actually having a good stipend is actually saving, because if you're in a state college, let's say in Karnataka, where fees stipend is approximately I think around 60,000. Okay, now they have updated. Earlier it was 45 something. Now they updated to around 60. Okay, approximately 60. But versus in a central institute where you're getting up to 1.3 lakhs. Okay, so here it's almost double. Okay, and then even though I agree that expenses are more in metropolitan cities like Delhi, expenses are more, but still you end up saving at least like 70 to 80,000 even after cutting off. Let's say not 70 to 80, but you at least save 50,000, right? 50,000 is your minimum saving, and you can invest it somewhere and you'll get good returns. But versus a South Indian college where you're getting just 60,000 or maybe 50,000 in Tamil Nadu, it is the lowest. So there won't be any savings at the end of 3 years. Okay, so what I want to say is you should start focusing on beyond 3 years also. It is not just your residency. You should start focusing beyond 3 years also. Okay, so this I think is one important aspect. Okay, and also fee structure also, which is very important because states like Maharashtra and Karnataka have way higher fee structure. Okay. Next is important is toxicity. Now there are 2 markers for toxicity that you should always ask. Always ask these 2 things whenever you want to ask about toxicity. One is how many people have left the institute. after joining the institute, like if you see Safdarjung, that is VMMC surgery, general surgery, every year like 50% of the student drop out. Okay, so that means it is very toxic that people have to drop out. And second is how many suicides have happened in the institute in that department. These two factors tell like what is the level of toxicity. Okay, these are the only two questions that you need to ask. You don't have to ask like how are the seniors, all those, no, because everywhere there will be some level of toxicity in medical field, and in branches like pediatrics, OBG and all, there will be higher level of workload, work hours will be hectic, everything will be there. But if people still choose to continue the same branch despite having all this, and like people are like happy at the end of third year, then definitely that college is a good one. I can vouch for mine. I am very happy right now. Okay, so next is accommodation and accessibility. See, like northeastern states, okay, and like let's say you are from North India and then South India becomes difficult for you. So all these few things are actually the ones that determine your like how close you are to home, because the closer you are to home and closer you are to culture, the better your 3 years of residency is going to be, because believe me, these 3 years of residency are going to be hell for you. Next is hands-on exposure. So this also I came across. This is not only true for surgical fields, even for medical fields also. Like in pediatrics, many people started asking me how is exposure in RML in Delhi colleges, because it is SR based culture. So it depends totally on the institute wise. Like I can tell in RML hospital, in my institute, I had very good hands-on. Like I was well versed with almost every procedure. So from first year itself, we were getting good hands-on. So but some institute, especially DNB and peripheral institute, don't have proper setup. And in DNB, in peripheral institutes, you don't have setup. You don't have like what I can say is, for example, MD pediatric pass out from like Delhi institute, like RML hospital, that is ABVIMS, and pass out from like peripheral state institute, like let's say some state institute, second or third best college. There is a lot of difference, because I know procedure skills, like I can do handheld echo, bedside echo, I can do POCUS, everything is available in our PICU. But the same doesn't hold true, because when I was in my UG college didn't even have this bedside all these things. Okay, so there will be a lot of difference in exposure that you get from institute. So that hands-on and exposure and skills that you develop, that will be carried on further. Okay, it is not like you won't study, like you can do SRship later on from a good college. Like if you have done from some peripheral college or from DNB, I have seen many people coming to do SRship in like Central Institute. It's a good choice. So learning is not just limited for 3 years, it continues throughout life. Okay, so once you skills are easy to learn if you have continuous practice. Okay, so if you are like you are okay with taking a college near your home or in your state itself, it's okay, because senior residency you can do from a good institute. Next is tag of MD versus DNB. Again, I would say this is limited for like metropolitan cities, okay, and in tier 1 and tier 2 cities. In district hospitals and in clinics, and if you have your own setup, no one is going to ask whether you have done MD or DNB. If you are a pediatrician, you are a pediatrician. If you are a cardiologist, you are a cardiologist. No one is going to ask anything. Okay, so this is a 8-point objective system. Now, how do you grade this? I have devised a simple technique, that is, if it is good, then it is 3 points. If it is average, then it is 2 points, and if it is bad, then it is 1 point. Okay, so let's say you have 2 institutes. Okay, I have discussed this earlier also. I think it's easy to like let's say you want to know about I'll take my example itself, pediatrics in RML, okay, versus pediatrics in let's say my UG college, that is MMC, Mysore Medical College. Okay, so for me, I'll grade these two. I want to show you like how it differs totally. Okay, like academics is almost good in both. I found that academics is good in both. It is not even average, it is very good in both. Work-life balance is very good in RML, and here I'll give like average. Okay, it is not very bad, but it is average. Infrastructure wise, RML is very good in infrastructure, and Mysore Medical College is actually very poor, I would say, because not poor, okay, I'll give average, because it's not very bad as some peripheral institute, but not good as central institutes also. There are many procedures are not being done there. Bond wise, there is like 1 year bond in Karnataka, so definitely I don't like it, bad. But RML had no bond when I took, and stipend fees and all was very good, so I again give 3. Toxicity wise, RML I felt was very less toxic, so still I can give 2 or 3. I'll still give 2, because pediatrics as a branch has slight toxicity. In Mysore Medical College also toxicity was not there, almost I can give 2 only. Accommodation and accessibility, like this is very close to my home, so I'll give 3, because not very close, but I can go home as and when I wish. And accommodation was also, there were hostel facilities available, so 3. In RML, hostel facility is very good, like I can't tell. And accessibility is also good, because in flight it doesn't take much time. Okay, And hands-on exposure, very good in RML, also very good in MMC. Whatever procedures are there, you are getting free hands. And MD tag is also there in both, but RML is slightly better because it's a central institute. So overall, you'll see that this objective scoring system, out of 24, you will get total score. So this is how, when you have different options, when you have multiple options, what you can do is you can go ahead with all the colleges and put this objective system. That will help you to objectively put your choices in the choice list. Okay, this is how you should proceed ahead. This will ensure you that you don't make any mistakes, you don't make silly mistakes, because what problem will happen is you will talk to one person, you will talk to other person. First, when you talk to one person, he'll have some opinion and you'll be like, okay, I'll go ahead with this. Then you talk to second person, he'll have some opinion and you'll be like, okay, I'll go ahead with this. And you talk to third person, and when you talk to everyone, you'll be so confused, you don't know what to do, and there is only 1 week left for option entry. So this shouldn't happen. Okay, next is, now once you have finished your priorities based on your objective scoring, this is 8-point objective scoring system. Now one important thing that you need to realize is, what everyone does is, you don't understand how algorithm works for MCC website. In counseling, the algorithm works like this. Like, in first, it will go for rank 1. What are the choices given by rank 1? Whatever choice given by rank 1 as first choice, that is a seat allotted to rank 1 candidate. Okay, now when it comes to rank 2, rank 3, etc., let's say your rank is 1156. Okay, now what will happen is, your first option, okay, your first option, let's say, is let's say you have given option A, here you have given option B, then option C, option D, like this. Okay, you have given like total 5 options only. Okay, like option E. Now how the algorithm goes is, it will see your first option. Okay, if this option is available and no one before you has taken that option, then it will allot you option A. But what happens most of the times is, this whatever your option is, it will be like on the higher side, right? Like you will be giving the best college. So option A or B won't be available for you. Even option C, D also may not be available for you. Then directly it might go to maybe some fifth option, E is available. So it will allot you option E. Now where the problem lies is, if you suppose your rank is like 10,000, okay, and this is for mainly for mid rankers, okay, 10,000. Now what happens is, if you are very specific in your rank range, like you have given options in Zynerd just for like 9,000, let's say you are given only for like 9,500 to 10,500. Now what will happen is, last year maybe there was a seat in Madras Medical College. I'm just giving an example, Madras Medical College anesthesia at a rank of 11,500. But since in Zynerd you had given a very short option, okay, you had given only small rank range, what will happen is, you won't keep Madras Medical College in your options. Or secondly, you might keep Madras Medical College somewhere below, because you might think that it is not at all there in the option. Okay, so what will happen is, even though you would have got that college, if you would have kept that in option 1, you would have kept it for option later on. No, but let's say option C was available for you because no one had taken, so it will give you option C and you will lose a valuable seat here. Similar thing occurs when you have like some category, let's say with the EWS category, last year one college didn't have that reservation, but this year in seat matrix you didn't look after it, you didn't go through seat matrix, and suddenly this college appears in the seat matrix, but you forgot to add that option, or you kept that lower below, and this year EWS seat is available for that. The one person after you will get that seat, but you will miss that seat. I have seen this occurring multiple times. This is one place where everyone goes wrong. That's why you need to understand algorithm. So even though you may not get that college, let's say your rank is around like 10,000 and maybe MAMC ortho is not in your choice, okay, but still keep as it, if suppose you're going to keep ortho, MAMC or Central Institute as your first choice, because we don't know how many people ahead would have kept it or how many people ahead would have not marked it. Maybe this time some additional seats were had come into MAMC ortho. We don't know what happens, okay, because after a rank of 1,000 everything becomes unpredictable. So it is always safe you start with highest priority option, whatever, however unlikely it is, you keep that. Okay, second is, if you might ask me, my rank is like 20,000, so in this rank range I can give thousands of colleges, I can give hundreds of colleges, so how can I manage? So ideally for a rank of less than 1,000 you should give total 30 colleges, at least 30, okay, and for rank of more than 1,000 you should have more than 30. I would say ideally what is required is if your rank is more than 10,000 you should have at least 100 colleges in your choice list. That is when you have done your homework and you know that yes, I can get all this. And then, because I'll tell you, by the end of third round now, the counseling process becomes so messed up with the state counseling and all India counseling. Even at the rank of 10,000 you might miss a good seat because you were not prepared for this. That's how important this choice filling list is. Now let's come to case scenario. So first case scenario is, you have got a rank of around 5,000 and you need a clinical medical seat. So how will you proceed? So first thing is, you will go to Zynerd and you will enter rank range of between 3,000 to okay, you can actually enter from 2500 to 7500. So you're entering a broad rank range. That is because you know that there might be some seats, additional seats which might get added. This year maybe some, like every year in pediatrics, n number of seats get added. That is because in every institute, once a new consultant comes or a new professor comes or a new professor joins, or someone who had left the college to do DM comes back, then new seats will be added, because PG seats are decided based on how many professors are there. It is not based on random number generated by MCC. No, it is based on how many professors are there. Once the number of professors increase, number of PG students also increase. Okay, remember this. So that's why anytime new seats can get added. So suppose you keep a rank range of 4000 to 6000 for this rank. What will happen is, maybe at a rank of like 3500 last year, a college X in some periphery, okay, in a state, had MD medicine seat, okay, but this year there 5 seats got added, and now this year's rank range will come in the broad range of like around maybe 5000. It might go up to 5000 and you will lose this seat. So that's why keeping a broad range is very important. Then after that, what you will do, you will take the list of all colleges and then you will talk to these people. Okay, you will talk to each people. Okay, you will also go through all the branches, medical branches. So what are the clinical medical seats? You have medicine, you have dermat, you have radio, and you have, last option is anesthesia. Okay, and one more is pediatrics. Okay, so these 5 branches will be going through, and then you'll be talking to this, because I'm talking clinical medical. Okay, I'm not talking clinical surgical or non-clinical surgical and all. Okay, so you'll talk to the people over that college, because why talking is necessary, because what I feel is, if you take randomly seat in any institute without talking to people, you end up leaving that seat. Okay, this is a common case scenario that I've seen. Okay, people leave seat because of toxicity, because they have not talked to people. Believe me, most of you will land up in that position. So talking to people over that is very necessary. Then you devise the 8 objective point system, which I've already discussed, and then you finalize your list. Got my point? This is for a rank of 5000. Now for rank of 18,000, again you'll see in zynerd which are the branches that is available, because as your rank increases after 5,000, you will now focus more towards branch, because now you want a college. So now it becomes a two-way thing. That is, one, if you are affordable or if you are not affordable. Okay, if you are affordable, like if you are able to afford private seat, then you can go with your dream branch in any private college or any private DNB institute. Dream branch, whatever your branch is there, in private or DNB, because at this clinical seat is not possible. Okay, private or deemed university or something. Okay, or private DNB. If you can't afford a clinical private seat, okay, not affordable, your like budget is not there, then what you can do, you have to choose alternative branches. Okay, so like let's say clinical seat, you won't get for medicine, you won't get government MD seats anywhere for 18,000. You won't get pediatrics, you won't get dermat and radio. All these are out of question. You might get in private DNB, but not in government setup. So now what you will do, your alternate branch is anesthesia for clinical medical. So anesthesia definitely is available. Good seats are available under this rank. So you go through the same process again. Okay. Coming to third scenario, let's say your rank is 35,000 and you need a paraclinical seat. So 35,000 paraclinical seat, good MD colleges are available. So you'll go ahead with your dream branch on there. Okay, your dream branch, and then you will go ahead with, suppose you want a paraclinical seat, let's say patho, and you will find all the patho colleges, you will find all the micro colleges, you will all find all the PSM colleges, you will find all colleges which come under everything. You will also try for clinical seats under ENT and ophthalm, because these are also accessible. Okay, because if you're affordable, then you can try this. Okay, but if your choice is paraclinical, then you can go ahead with this. Again, talk to people over there, find about toxicity and all, then prepare a list. Okay, so it goes like that. Okay, and next is rank of 60,000. So not much options are left, like most of the MD and government seats get exhausted here, but still you have some options like PSM government setup you will get, paraclinical government setup you will get. Okay, if forensic medicine you will get, and preclinicals. Okay, these options are available, plus depends on reservation now. Okay, for after 60,000 everything is based on reservation if you want a very good seat. Okay, but if you want any seat in this attempt, again that depends on, first thing is affordability. So I tell always, this is a very sad state of affairs in India, that a MD seat is dependent on 2 factors. One is how much money you have, and second is what reservation category you have. It totally depends on these 2 factors, because if you have money, you can buy any private clinical seat anywhere. Okay, and if you have reservation, you can get any good college. Okay, so it sums down to this. In addition to this, you just need, if you want to crack this system, then you need a very good IQ and a consistency. This is what is required before exam, and this is what is required after exam. So this is to sum up things for this one, but you shouldn't be disheartened. You have to accept these facts. Okay, now next point is, what about branches versus colleges. Okay, this is what I get frequently. Like I'm getting a peripheral MD for pediatrics versus peripheral medicine college, okay, versus a central pediatric center. This is my case scenario. I'll tell you what I chose. Okay, so this depends on various other factors. That's where the 8-point objective system comes ahead. Okay, so I could have easily got into peripheral medicine colleges and versus central pediatric colleges. See, my branches were not very different. Medicine and pediatrics almost go hand to hand only. It is just that pediatrics has some different core principles, medicine has core principles, but altogether it is mainly about diagnostics. Okay, it has nothing to do with surgical. If it was like peripheral medicine versus central surgery, my option would still be peripheral medicine only. Okay, surgery, because it is totally different. So there are broad 4 headings. One is clinical, medical, clinical, surgical. Okay, then non-clinical medical, and non-clinical surgical. If you go to my previous video, which I released 2 months back, you will get all this which subjects come under this. So if it is within the same branch, okay, within the same category, clinical, medical, taking radio, dermat, medicine, pediatrics won't make much of a difference, because all are medicine based, evidence based medicine, and all are like towards more of towards diagnosis. Okay, if surgical like OBG, ortho, surgery, more are towards surgical principles, so it doesn't matter. But peripheral and central, what matters is if you have like same within the same category only, if you are going to get said, then always you can choose. If your second option is pediatrics, or if your third option is radio, dermat, then you can choose central institute, because central institute has got its own perks. Okay, so what I mean to say is, by choosing alternative second or third branch in a good institute, it will actually promise you a better future compared to taking that in a peripheral institute. The only exception is if you want to do a SS, you can take a peripheral institute only, because your DM seat will actually matter at that time. Okay, now what are the warning things? This is a must. Okay, you can't afford to miss this. Okay, first thing is domicile is still available, as I told earlier. Okay, go through your state specific counseling websites and then like go to the eligibility criteria. Second is there are a lot of false information in groups, WhatsApp groups. There are people who call you and tell you that this seat may not be available, or this seat will be available, so they will be misguiding you. So beware of this. Don't trust anyone. Verify all the information before you get it. Okay, third is MCC website is very cumbersome. When you think, no, like it is easy to fill 30 options. I had given total 27 options, and I was so frustrated at the end of 27 options. That website, no, it reloads again and again. You have to log in again and again. Okay, so it will be very frustrating. So don't keep this for last 2 or 3 days. Start from the first day itself. Start entering your options and cross verify, because by the time I entered 27th option, I was like, okay, I don't want to look any further into this. I'll just submit it. Okay, so it will be so much frustrating. Okay, so if you have like more than 50 options, you should be very patient and preferably use a desktop. Okay, next, things will be very, very fast once the counseling process starts. You won't know what is happening. One side all India quota second round is happening, and the other side your state wouldn't have even completed first round. So maybe you would have given your seat in first round, and in second round you would have wanted to get an all India quota seat, but you can't surrender your seat. So many things happen, and so many messy things happen. Okay, so you might be stuck in one set of counseling and you won't be able to do all India counseling at all. So all these things are going to happen, so you should have a very calm mind during your counseling process. So take opinion from your experts. Okay, next, keep budget ready, because once you're like not sure whether you're taking all India or state quota, you will have to go here and there in flights, or you might have to go away, like you might have to pay fees, and then you have to keep some extra budget, because fees refunding also takes time. You might have to do admission twice, thrice, depending on how many times you have got the seat. Okay, so all this will matter a lot. Okay, next is some state choice fillings happen only once. Okay, this is very important, because in Kerala case state counseling, what happens is, once whatever your choices you fill, no, that will stay permanently. You are not allowed to enter choices again in second and third round. This was state counseling, what I'm telling. Okay, so what will happen in Kerala is, you give college A, B, C, D, E. Suppose you got college D in first round, your E will be eliminated, but this same list will continue. In second round, if you give option B, then C and D will get eliminated. So you are left with either only A and B for upgradation. You won't have fresh choice filling. So this might happen in some other states also, but you should be aware of this. Okay, so a few additional information regarding zynerd I want to give, which helped me was, one was rank scan. Okay, and second was allotment mapping. All these points are discussed in my video, which has got somewhere around 69,000 views, which was released 2 months back. You can go back and watch that. Okay, I think the title of the video is Mid Rankers, How Will You Get Clinical Seats, something like that. Okay, so go back and watch that video. Okay, I have discussed detailing. So in any case of query, what I found is most helpful, even for my case during my counseling, just call this zynerd helpline. But I think that is only available for premium subscribers.